So we don't necessarily have data on the CAR T patient themselves, but we do have data on lymphoma patients overall and the impact of CAR T. And why we have that data, our survey actually runs through the first part of 2020, the survey data that we're looking at right now. And so it ran from January to March 2020. And at that point, COVID was obviously a big deal already in Asia, where there was lots of restrictions in place and new learnings coming through as healthcare systems learn to cope with COVID and how we manage lymphoma within that scenario. And so what we did is we compared the data from responses from Asia in 2020 to the responses from Asia in 2018 survey, and looked at newly diagnosed patients that had been diagnosed within the time frame that COVID had become an issue within Asia, and just compared their patient experience to a similar data set from 2018 where the questions matched up. And what we found there is there are differences in anxiety, isolation. All of those are quite increased in the 2020 population compared to the 2018, but also difficulties accessing care and good information on their disease, including diagnosis issues. And we know that relates to the problems where we were trying to figure out with hospitals. Patients were getting switched to different centers sometimes for their care, as the hospital they were used to going to became a COVID center or had a COVID outbreak, preventing patients from attending the place they had usually gone. We know that there are issues with patients wondering, even when they have symptoms, whether or not they should go to the doctor or not, because again, they have that higher risk of COVID, or at least they have a higher risk of poor outcomes from COVID. So there was a lot of fear. And already with CAR T, as we pointed out, we're already dealing with higher rates of fear and anxiety and depression than we would see in other lymphoma, relapse refractory large cell lymphoma patients. So this then we anticipate is exacerbated in the CAR T population. We also know from dialogue with patients, so this is anecdotal, it's not from our survey, discussions with patients where they have a procedure planned and then it was delayed because of a COVID outbreak, or there were more issues actually getting into the treatment than there would have been pre-COVID. Again, with the restrictions in place in hospitals, the requirement in many centers for an intensive care bed of some kind to be available for patients. So this uncertainty also increased anxiety with patients, where they were wondering if they were going to get their treatment, if they were going to get it in time. Is it safe for them to go into a hospital for care? And it's already, of course, a highly anxious time. So it compounded everything and has made the situation much more difficult for patients to cope with.